It's Dr. T, and in this episode, we're answering the question, what is the abortion debate really about? Well, ostensibly, abortion is the fight over whether a woman can decide to terminate a pregnancy, whether she gets to make that decision. Now, I want to talk just a little bit about medical language because sometimes it can be confusing because politicians don't always use the language the same way that physicians do or healthcare providers do. So abortion simply means a pregnancy that ends. So there are lots of different kinds of abortion. There are spontaneous abortions, which is what we colloquially call miscarriages. There are what's called a missed abortion as a medical diagnosis. I actually had 2 of these. It's where you're pregnant and ultrasound or some other test determines that the pregnancy isn't viable. Nothing's happening, nothing's growing, there's no heartbeat, etc. And so you are going to miscarry. And so then you can decide whether you want to surgically intervene with a D&C, which is what's usually used to perform any kind of elective abortion, and remove the contents of the uterus, essentially. So that's a missed abortion. If you know the pregnancy is already ended, essentially, but it just hasn't terminated on its own, hasn't spontaneously aborted. There's an elective abortion where you decide, I don't want to carry this fetus for whatever reason and choose to have that procedure. There's a medical abortion, which is using a pill, right, mifepristone, to induce the abortion without surgical intervention. Now, I want to highlight that there is a term that's used in politics called partial birth abortion. There is no such thing as that medically. They use that to talk about late term, where you go in and rip the fetus out limb from limb, and they try to make it as gruesome sounding as possible. That is not an actual medical procedure. There are times when there are fetuses that aren't viable, aren't going to survive. They don't have brains, for example, and they don't realize that till later in the pregnancy. So they aren't going to live. They're never going to take a breath. And they go in and do a procedure to remove that fetus. But it's not as if you're choosing to electively abort this baby. And this idea of partial birth, again, that's just a fiction of the political right. There's other political language used to talk about who's on which side of this debate. There are terms like pro-life, pro-abortion, pro-choice, anti-choice. They all have different connotations, right? Pro-life means you want people not to abort. You want people to carry the fetus to term or to whatever conclusion, no matter what. There is pro-abortion, which is how people who are opposed to abortion usually characterize people who support choice, right? Most people would say they are pro-choice if they are supportive of having abortion be available. Not necessarily pro-abortion. There are a lot of people who would say, I would never choose to have an abortion. For whatever reason, I don't like the idea of it, but I'm not going to make that choice for somebody else. I recognize that somebody else may need to make that choice, and I support their right to do that. So some people who are pro-choice will use the term anti-choice to describe people who think of themselves as pro-life. Pro-life is an interesting term, though, because many people who are pro-life are also pro-death penalty. What they really are is pro-birth, because they tend to support other politicians and policies that would not provide, let's say, nutrition and healthcare and education. They want to take money away from those things. So they want babies to be born, but they don't want to support the actual supporting of those babies as they grow up, as they live their lives. So that's some of the terminology that's used. Approaches to abortion have varied over time. So in much of the U.S. prior to Roe v. Wade, which was decided in 1973 by the Supreme Court, which said women had the right to privacy and the right to make their own reproductive decisions, those decisions were controlled by hospital boards in hospitals across the country. So if you had a circumstance where your pregnancy was not viable, or maybe you were bleeding a lot and your health was in danger, you would have to go to this board and plead your case in order to be allowed to get an abortion. So some boards were much more liberal than others. Some boards would just kind of rubber stamp them. Others were much more tightly controlled. I grew up in Michigan, and my best friend in high school, his mother almost died because the board would not allow her to get an abortion. There was still a heartbeat. The pregnancy was termed not to be viable, though, and she was going septic, and they would not allow her to have that procedure. So there are a lot of women who had to wait till they were almost dead to be able to get permission under that system. Now, a lot of abortion and opinions on abortion and which side you take on the issue is linked to your commitment to a faith community, your religious traditions and convictions. And even some of those have changed over time. Now, the Catholic Church has been opposed to abortion pretty consistently, but prior to the late 1970s, the very conservative Southern Baptist Church was not opposed to it. In fact, explicitly stated that it was allowable in most, if not all, circumstances. Now, very quickly in the 1970s, that shifted and it began to be used as a political wedge issue. And there were some conservative evangelical churches that did not see it the way the Southern Baptist Church did and saw it as an assault on traditional values. One of the most dominant voices in this arena at that time was Phyllis Schlafly, who was a well-known conservative political organizer and activist. And she campaigned greatly against legalization of abortion, against the Roe v. Wade decision. And it was under Reagan during his 1980 presidential campaign that abortion began to be a wedge issue. And it was a very effective way to try to peel Catholic voters away from the Democratic Party by taking this very strong stance. But prior to that time, it really was not a political issue, and it was not something that was fought over in that way. So this assault on traditional values, this is the key for many of the most ardent abortion supporters. So it's not just about when you think life begins, which again is often tied to one's faith tradition or moral allegiances, if you will. But this idea that if you allow abortion on demand, which is the way it's often put, and also allow a contraception, so the availability of abortion is not just about the taking of what they see as a life, it's also about the availability of contraception, because those two things together make recreational sex possible. It removes sex from something that, as they see it, should be only within marriage. When you lose the consequences of pregnancy associated with sex, then you can do it anytime, anywhere, right? And that's not something that aligns with those traditional values. Very contrary to conservative Christian evangelical values. The larger cultural shift that was also taking place in the 60s and 70s, you can go back to the episode on what does it mean to be a feminist, because we talk about this in the previous episode. There's a shift toward women wanting greater equality and deciding that they want to be educated, they want to have jobs of their own, they want to have money of their own. They may choose not to marry, they may choose not to have children. All of those things are undesirable. And specifically, this idea that the Bible teaches people who take it literally, women should be subservient to their husbands. And of course, all of this push towards equality and feminism is a rejection of that. So all of these things together, the availability of abortion, of contraception, women's liberation, and push for equality, they are all assault on traditional values. So opposing abortion is really about opposing sex outside of marriage, about opposing greater equality for women. It's also about opposing family forms other than the conventional one man married to one woman. So it's about a way of life. Now, I mentioned earlier about some political language that's used that's misleading about abortion. There are some flat out lies that are told by the anti-abortion folks to try to further their cause. So one of the things that you hear, and we heard about this even in the 2024 election, this idea that Democrats and people in Democratic-led states are all for and are actually allowing right now, currently, people to abort fetuses right up until the moment of birth. That is absolutely untrue. It is illegal everywhere in the country. It is infanticide to do that. Nobody is doing that. Nobody's doing that. It's just a lie told to gin up outrage on the anti-abortion side. They also push this idea that abortions harm women psychologically and that women regret having abortions years later when you ask them. That's not true. Some women, a small subset of women might say that they do, but most of the research says that women say it was the right decision for me in that moment and I would do it again. They do not suffer psychologically from making that decision. There's also a lie told that it harms women's health and their future fertility. Not true. And in fact, I put a very, very recent study, a link to it in the notes for the show, that go through all of the things about their ability to get pregnant, whether they have complications in pregnancy, that the research out there that purports to claim that there's a link between poor outcomes for women later on is not well done research. The research that is well done does not show any harm to women's health in terms of getting an abortion. What do we know to be true? Well, in the wake of the reversal of the Supreme Court decision in June of 2022, where they overturned the Dobbs decision, where they overturned Roe v. Wade, we've got a lot of new anti-abortion laws that either kicked into effect because they were on the books and the Supreme Court had suppressed them previously, or new laws that were written that are very, very strict in terms of abortion. Usually they have like a 6-week window or sometimes outright bans. And so what this means is that women are not able to not just choose to terminate a pregnancy that they don't want, but they can't get termination of pregnancy when it is in their best interest, when they need it for their health. So it's doing a couple of things. There have been women who have died. They've been to the emergency room bleeding, and they've been told, we can't do anything for you because there's still a heartbeat. So they go and they bleed out somewhere and they die. Or they get septic and they die. Or they have an ectopic pregnancy, which if an ectopic pregnancy is a pregnancy in the tube, it's in your fallopian tube. And eventually that is going to explode the tube and you're going to bleed to death internally. There is no way for a fetus to survive an ectopic pregnancy, but they are refusing to treat ectopic pregnancies or waiting until the last possible moment when the tube is destroyed. So now you have harmed the woman's fertility. It's going to be harder for her to get pregnant in the future if she's missing one of her fallopian tubes. So what this means is that women are not the priority anymore. The fetus is the priority. The potential well-being of a fetus, giving it every possible opportunity, is placed over the well-being of the woman, to the point that we have this poor woman, Adriana Smith in Georgia, who was brain dead in a coma and 10 weeks pregnant, and she was forced to serve as an incubator for her fetus because that's what the law says in Georgia. Her parents wanted to take her off of life support. They saw that as a humane thing to do. She was forced to serve as an incubator. We do not force anyone in this country to give any part of their body to anyone. You can't be forced to donate blood or bone marrow or a kidney if you're healthy. We can't even take organs away from dead people. So dead people have more rights than live women now under these new anti-abortion laws that are sweeping across the country. Where are we going? Well, in the big, beautiful bill, which I did an episode a couple weeks earlier about this, we are putting more strain on insurance companies, punishing them under the insurance exchange, under the Affordable Care Act. If they provide abortion care, they don't get the subsidies. So they're being financially punished by the government. And all of this is completely out of line with what the American people want. If you look at the polling on this, people support the right to abortion, even if they say they don't see themselves ever being able to choose one or wanting to choose one. They support it being safe and available. They support women over the fetuses. They do not believe that fetuses should be given more rights than women. So the American people are not on board with this taking over of women's bodies and forcing them to bear children. So the debate is not just about the life of a fetus. It's also about a life of a mother, and it's about what kind of values we support in our society. That's what's at stake.